Hello everyone, my name is Dr. Babatunde Okewale. You're welcome to another episode in how to get pregnant and have a baby. Today we'll be talking about semen analysis. It is one of those investigations we do, especially for male, when a couple presents with infertility. Before I go on into the details, I would like to talk about how to get pregnant on its own. To get pregnant, there are basically 5 requirements. The first requirement is the sperm of the man must be of good quality and it must also be of good quantity. The second requirement is that the woman must be seeing her period. She must be able to know her fertile period and the time she is ovulating, because it's at that time, if a woman and a man makes love, that pregnancy can occur. The third requirement is that the inside of the womb of the woman must be able to accept and be able to keep a pregnancy. There shouldn't be anything in there, whether it's a fibroid, whether it's a polyp, whether it's additional or an infection in there. The fourth requirement is the woman's tube, that is the fallopian tubes, must be open so that the eggs can pass through the tube and the sperm can pass in there and fertilization would occur in there. And finally, the woman must be producing quality eggs. Now, you will see straight away from these 5 requirements that if you're trying to investigate a couple, you have to check those 5 steps. And out of those 5 steps, only one involves the man, which is the semen. And the thing is, it contributes to 50% of all infertility. That is, male infertility contributes to 50% of all infertility. So how do we do semen analysis? The advice you give the man is that he must abstain for at least 2 to 3 days before he produces the semen. The semen is preferably produced by masturbation rather than coitus interruptus, which means the withdrawal method. Some men produce the sperm in the condom. That is not advisable because the condom, the normal condoms, contain spermicide that could kill off the sperm. And the sperm must get to the lab within 1 hour of production. It should be brought to the lab within the normal body temperature. There's no need in putting the sperm in ice while you are bringing it to the hospital or to the laboratory. So what are the normal values in semen analysis? There are basically 5 things we check in the semen. The first is the volume of the sperm. The normal volume should be between 2 to 5 mils. The second thing we check is the sperm count. The normal sperm count should be between 20 million per mil to 200 million per mil. The third thing we check is the sperm motility. Motility in the sperm should be at least 50% progressively motile. The fourth thing we check is what we call the morphology, which is the shape of the sperm. At least 60 to 70% of the sperm must be of good shape. When we say a sperm is of a good shape, this is what we mean. A normal sperm looks like a tadpole. It has a head, it has a body, and it has a tail. That's the normal shape of a sperm. There are some sperms that have 2 heads. There are others that might have 2 tails. Or there might be others that don't even have a head. Normal morphology sperm should be at least 60 to 70% of the normal shape. And the last thing is there should be no bacteria inside the sperm. Now, when we look at the sperm and we get all these figures, the most important figure there is the sperm concentration, which is the sperm count, which everybody talks about a lot. The statistics with the sperm count is this. We've already established that the normal count should be between 20 million to 200 million. So if a man has a sperm count of less than 20 million, we say he has low sperm count. Now, the statistics with that is this. If a man has a sperm count of 30 million, which is within the normal range, and the wife is okay, the chances are pregnancy will occur within 1 year of trying. If a man has a sperm count of 20 million, which is the lower limit of normal, and everything is fine with the wife, the chances are it might take 3 years for pregnancy to occur. If the count is 10 million, it might take 6 years. And if the count is 1 million, it might take 12 years. You will see straight away from that the lower the count, the more difficult it is to achieve a pregnancy. Now let's take each of the parameters one by one and try and see what could cause the various disparity in sperm count. If we take the volume, we've already established that the normal volume should be between 2 mils to 5 mils. What if the volume is low? That is, it is far below 2 mils. What could be responsible for that? It could be due to spillage. It could be due to frequent ejaculation by the man. And that's part of the reason why we say the man should abstain for between 2 to 3 days before he comes for his semen analysis. It could be due to retrograde ejaculation. Retrograde ejaculation means instead of the sperm coming forward during orgasm, being ejaculated forward, it's ejaculated backwards inside the bladder. There are specific conditions that cause that. It could be due to prostatic or seminal vesicle abnormalities, and sometimes we might not know the reason why there is a low volume sperm. Another thing that could happen if we take the sperm concentration, these are the things that could happen, that is the sperm count. If the sperm count is low, we call that oligospermia. Sometimes you don't find any sperm inside the semen, and we call that azoospermia. This occurs in about 2% of male population. Now, what could cause oligospermia? It could be due to stress. It could be due to taking some drugs like nicotine, alcohol, or even the hard drugs. It could be due to environmental problems. It could be due to endocrine problems, and sometimes we don't know why this has happened. Poor motility. We've already established that at least 50% of the sperm must be motile. If there's low motility or any motility that is less than 50%, it could be due to, again, not knowing why. We call that idiopathic. It could be due to the fact that the sperm was produced inside the condom. Or sometimes it could be that the sperm was not brought to the lab at the right time, that is, after 1 hour. Sometimes it's due to infection, and sometimes it's due to some immunological factors. When you find bacteria inside the sperm, it could be due to sexually transmitted diseases, and sometimes it could be due to contamination in the way that the sperm was collected, and sometimes it could be due to inflammation of the prostate. So when we do semen analysis, we analyze all these 5 parameters, and then specific decisions are made. If this problem is low sperm count, depending on how low the count is, specific treatments will be preferred. So depending on what you find in the semen, when you do a semen analysis, the treatment options are varied depending on what the problem is. But the most important parameter for someone who is trying to get pregnant is actually the sperm count. The 4 treatment options available are these. We could decide to do nothing, that is as a couple, especially if the sperm count is not too low. And going by the statistics I gave earlier on, if the count is 19 million, which is just on the borderline, the couple might decide to wait on statistics. That is, they know that they are going to get pregnant within the next 3 years. If the count is below 10, which is severe oligospermia, then the couple needs to be thinking in the direction of some form of assisted conception, especially if there's nothing wrong with the woman. Could be looking in the direction of intrauterine insemination or IVF. Sometimes the couple or the man might decide to go in the drug direction. That is, he tries to take some drug for some time. Drug can be useful, but it has its own limitation. For example, If the count is 15 million and a man decides to go on some certain drugs for the next 6 months and the drug doubles the rate and brings it to 30 million, we will say the drug has done well because it has brought the count to within the normal range. But if the count is 5 million and the man uses the drug for like 6 months and the drug doubles the rate to 10 million, the drug will have done its own job of doubling the rate, but the count will not have reached the normal value. If you want to know more about semen analysis and other methods of investigating infertility, I will recommend my book called How to Get Pregnant and Have a Baby. It's available on Amazon. Thank you for listening to this short talk on semen analysis. I'll be grateful if you can subscribe, like, and share this video. Thank you.